Preparing clinics for the age of climate instability is no longer a matter of long-term planning. It is a matter of immediate survival. The steady march of extreme heat events, floods, storms, and disease outbreaks is rewriting the rules of healthcare, and the old assumptions about predictability and resilience are crumbling. Clinics, once designed for stable environments, now find themselves on the front lines of overlapping crises. Heat waves that knock out power, floods that contaminate water supplies, and surges in patients suffering from both physical and psychological effects of climate stress. The challenge is not simply to adapt, but to reimagine what preparedness means in a world where nature's next move is increasingly violent and unpredictable. The first and most urgent priority is confronting extreme heat. Rising global temperatures and ocean-driven heat waves are pushing regional climates toward record-breaking highs that are lethal not only to patients, but to medical infrastructure itself. Clinics without adequate cooling systems become ovens. Medications spoil, diagnostic equipment malfunctions, and both patients and staff succumb to heat exhaustion. Power outages make matters worse, turning the simplest treatments, like administering oxygen or storing vaccines, into logistical nightmares. The solution is not just air conditioning, which is energy-intensive and fragile, but structural resilience, reflective roofs, natural ventilation, shade structures, and passive cooling designs that allow clinics to function when the grid fails. Generators must run on low-emission fuels, and battery storage systems should be standard, ensuring critical functions like refrigeration and communication survive the worst heat spells. Yet physical protection is only the beginning. The true danger of climate shocks lies in their unpredictability. Sudden floods, wildfires, and heat waves can arrive without warning, bringing not just injury but cascading health emergencies, infectious disease outbreaks, mental health crises, and chronic condition flare-ups. Clinics must evolve into rapid response hubs, equipped not only with emergency medicine but with flexible protocols that anticipate multiple disasters at once. A clinic in a drought zone should have plans for mass dehydration and respiratory distress from dust storms. A coastal facility must prepare for storm surges, contaminated water, and vector-borne disease outbreaks following floods. The medical supplies of the future will look different too. Heat-resistant drugs, portable coolers, solar-powered diagnostic tools, and water purification systems will become essential. Clinics must maintain emergency stocks of rehydration salts, antibiotics, and wound care materials for post-disaster treatment. In areas prone to extreme heat, intravenous fluids, fans, cooling blankets, and electrolyte supplements should be available year-round. This is not luxury planning. It is the minimum required to keep patients alive during sustained heat stress events. Equally important is preparing healthcare workers themselves. Doctors and nurses are increasingly collapsing under exhaustion during heat waves, their judgment impaired by dehydration and lack of sleep. Clinics need heat safety protocols for staff, including shorter shifts during peak heat hours, hydration schedules, and rest areas designed for cooling. Psychological support is just as crucial. Every disaster now brings waves of trauma. Burn victims from wildfires, flood survivors who have lost everything, children sick from contaminated water. Medical workers cannot provide sustained care if their own resilience is broken. Public health communication must also evolve. Clinics should not only treat patients, but act as trusted sources of climate risk information. Simple, well-timed guidance, when to stay indoors, how to hydrate, how to recognize heat stroke, or where to find clean water, can save lives before emergencies even reach the hospital door. In this sense, every clinic becomes both a healer and a teacher, reinforcing community awareness of environmental hazards and preventive action. Water and sanitation are another critical frontier. During floods or heat-induced droughts, access to clean water becomes precarious. Clinics must invest in independent purification systems, elevated storage tanks, and backup wells to ensure that medical procedures and hygiene standards do not collapse under environmental stress. The spread of waterborne diseases such as cholera, leptospirosis, and dysentery is inevitable after climate disasters, and clinics that cannot guarantee sterile conditions may become sources of infection themselves. Perhaps the most sobering challenge is that climate shocks do not occur in isolation. A heat wave can precede a flood, a drought can worsen wildfires, and each event leaves behind a trail of chronic illness and psychological trauma. Health systems cannot afford to treat these as isolated crises. They are part of a continuous pattern of climate-driven instability. Clinics must integrate climate forecasting into their operations, using data to anticipate patient surges and pre-position supplies before the next disaster hits. Technology, remote sensors, mobile apps, satellite weather data can turn small clinics into intelligent nodes of resilience, capable of acting before chaos strikes. But despite all these adaptations, the truth remains harsh. There are limits to resilience. No clinic can be fully climate-proof in a world that continues to overheat. As oceanic heat pulses, as droughts deepen and diseases shift their range, healthcare systems will be pushed closer to collapse. The ultimate defense is not endless adaptation. It is prevention at the planetary scale. Cutting emissions, protecting forests, and restoring ecosystems are not environmental luxuries. They are acts of public health defense. Without them, clinics will find themselves fighting a losing battle against a planet that keeps getting hotter, sicker, and more unstable. The warning could not be clearer. The age of predictable seasons is gone, and with it, the luxury of complacent healthcare planning. Clinics are now lifeboats in a storm that is only intensifying. They must be built to endure heat, to move quickly, to heal minds as well as bodies, and to function when systems fail. Every delay in preparation means more patients dying on floors too hot to touch, more medicines spoiled in powerless fridges, more exhausted nurses collapsing beside their patients. The future of healthcare will not be measured by technology alone, but by how well humanity protects its healers from the heat of its own making.